Good evening, everyone. Thank you for joining us for our PharmaWise Health and Wellness series. This is my first time back speaking to the community center group since pre-pandemic, so it's good to be back and see so many faces, so many familiar faces. This event series is put on in conjunction with the town of Kingsville, the Kingsville Community Center, and Mainstreet Pharmacy and Wellness Center here in town. My name is Aaron. I'm the owner and pharmacist at Mainstreet Pharmacy. I know most of you here know me. This evening, we will be discussing immune health issues and preparing for the sick season, as it were. As we're in October and going towards cold and flu season, kids are back to school. We're seeing a lot more infectious disease illnesses coming out in the community, some mild, some not. And today we're going to discuss things you can do to help prevent, things you can do when you are sick, as well as some good general tips and tricks to try and keep you healthy throughout the year. Today's talk should be about half hour. We'll take questions at the end of the presentation, so if you've got any, save them up and feel free to ask at the end. So first thing we are going to talk about today is preventing common illnesses. Now, most of the common illnesses that come around in this time of year are all either transmitted by touch or close respiratory contact. So making sure that you are washing your hands, using proper hand washing technique. And I know everyone's been washing hands in here for at least 50 years, I think. But just as a quick review, when you're washing your hands, you want to make sure you're doing it using a proper technique so that you're not wasting all the time you spent washing by then immediately contaminating your hands. So when to wash, whenever you're handling, eating, or preparing food, after you've gone to the washroom, whether you're caring for someone who's sick or ill, when you're going through the garbage, and then any time throughout the day that your hands are dirty or soiled or have come in contact with anything that can potentially carry bacteria or germs. Money, for example, is a very common way that people don't even think about. You handle your money out of your wallet, put it away, touch your eye, touch your mouth, and that's a very easy way that communicable diseases can be transmitted. Now, how to wash. I know we've all had experience with this, but you want to make sure you're using hot or warm to hot water, as hot as you can stand. Get them well wet. You want enough soap that you can well lather your hands. And then when you're scrubbing, you want to make sure you get from your wrist to the tips on both hands. You want to make sure that you're scrubbing in the fingernail areas and in between the fingers. Then you want to make sure you're scrubbing for long enough. Sing happy birthday 2 times. Every time you wash your hands, it makes sure you get the right length of time for soap contact because the soap needs to wrap around the bacteria in order for it to work. Then make sure you're rinsing well, and this is the key part where a lot of people end up recontaminating their hands, especially in a public washroom. Don't turn the tap off with your bare hands. Use the paper towel you've just used to dry to turn it off, because how did you turn that tap on? With your dirty hands. You touch it right after you've washed, your hands are dirty again. A lot of people forget about that when they're out and about, and there's a lot of public washrooms where they're all hand dryers and you can't use paper towel. If you can, use your sleeve of your shirt, or if not, that's when we jump to hand sanitizer. A great way to kill bacteria, but it doesn't clean your hands. So it's not going to remove dirt, it's not going to remove chemical contaminants, but it is going to kill that bacteria that can cause a lot of these infectious diseases that we see this time of year. So if you're in the bathroom and you don't have the option of using a paper towel to turn off the tap, use some hand sanitizer. A lot of businesses, restaurants have sanitizer out nowadays. Since the pandemic, that's become ubiquitous. It's everywhere. Everywhere's pretty well got some out for people to use, both the staff and the patrons who are working or visiting, pardon me. But when you use sanitizer, you don't want to drown your hands. You want to use about a quarter size amount of the sanitizer. Rub it in well until it dries. It's the drying action that actually kills the bacteria. So if you're not letting it dry, if you're wiping it off while they're still wet, or if you're soaking your hands so much that it can't evaporate, you're actually going to not get any of the benefit from the hand sanitizer. And that's something a lot of people think is, oh, I can just drown it in sanitizer, it's good to go. Well, unfortunately, then it's not going to be as effective. It's not going to work as well. So, next we're going to talk about things you can do to boost your immune system. Now, this is going to cover a range of issues. It's going to cover some natural health products. We're going to discuss vaccinations. The one thing, and this is a revamped slide deck from pre-pandemic, the only thing I didn't put in here when I was going back through it was a discussion about masks. So I'll just touch on that briefly, because even though it doesn't boost your immune system, it is a good way of preventing the transmission of respiratory illnesses. Not so much for the person who is healthy, but when the person who's sick is wearing it, it prevents a lot of the bacteria from aerosolizing and being able to be breathed in by everyone else around. Now, of course, both of you are, the sick person and the healthy person. It reduces that even further. I love the analogy that we used during the pandemic of take two monkeys and they're peeing on each other. You put one of them in a pair of pants and the other guy not, the other monkey not. Well, the guy with the pants on is only going to get a little bit less wet. Both of them have pants on, no one else is getting wet. No one else is getting peed on, so you're staying healthier. You're not getting that exposure. So, first one we're going to talk about, this one is a natural health supplement. And before we jump into all of the natural health products, I just want to mention that just because a product is natural or organic or produced from a herbal supplement does not mean it's automatically safe. Arsenic and cyanide are natural substances too. So it's important to know when and how to use these products, and more importantly, what you can and can't use them with. Because a lot of these natural health products do interact with common prescription medications that you're taking and can actually lead to, even though it might help your immune system, it can lead to bleeding issues if you're on warfarin, or heart issues if you're on certain heart failure medications. So before you start a natural health product, and not just these immune boosters, but really any natural health product, you should talk to your pharmacist to review your medications beforehand to make sure that they're safe, that they're not going to interact with it. So first one we'll start off with is elderberry, which is derived from the berry of a plant that is used to help traditionally boost the immune system. Now, with it, you want to make sure that you are getting a product made from the actual berry. Elderberry is the name of the plant as well as the berry, and so some products use elderberry root or elderberry leaf. The immune boosting properties, the anti-inflammatory and antioxidant properties of elderberry are found in the actual fruit or the berries of it. So you want to make sure that you are using, if you're using it for this purpose, a product with the actual berry in it. The active component of it is an anthocyanid, which is used to help reduce inflammation as well as activate our body's immune cells to make them more responsive to outside products so that they'll go in and attack the bacteria a little bit quicker and a little bit more ferociously. There have been some studies done with elderberry that have shown that it will help to prevent H1N1, which is the major flu virus that most of our influenza vaccines since the H1N1 of, I think that was 06, have had in it. And it has been shown to prevent the entry of the virus into our cells. And if the virus can't get into our cells, it can't replicate, it can't cause symptoms, it can't make us sick. Commonly, it's used to prevent and treat the flu and the cold. Now, there have been some very mild studies of using it in the acute treatment of a COVID infection as well. But the data is really inconclusive, and the major reason for that is its major potential side effect is it can lead to an overaction of your immune system, which can actually cause damage to your own body, similar to an autoimmune disease where your body is attacking itself. The elderberry, if given in high doses, can actually cause that to occur. And that can lead to longer-term health consequences, more than the COVID-19 infection. So we didn't really see that data as much in flu and the common cold, but there have been the studies that have looked at elderberry in a COVID infection, which is, I know, the hot topic. That's what everyone in infectious disease right now is really worried about. Has been shown in higher doses to cause issues. So use it with caution. There's not a lot of data showing that it helps much with the COVID infections as it does with flu. But if you're using it in appropriate doses, likely not going to be harmful otherwise. Lastly, it's best available in a concentrated syrup, but there are also elderberry lozenges that you kind of suck on and they'll dissolve and melt down your throat. Almost as effective, but the preferred form for elderberry is in the syrup, just because the things that they make to use to make it into a lozenge or a pastel can actually inhibit some of the action of it. Oregano oil. Now, this one's been a folk remedy for a long time. Couple of things to note with it, though, is when you're looking at it, you want to make sure that you're getting a product that has at least 80% carvacol, which is the active ingredient of the oil of oregano. If the product you're looking at doesn't have at least 80%, or even worse, doesn't list a percentage of the carvacol, it's not worth your money. It's not going to do you any good, and you're just really buying pungent oil that you're going to put under your tongue. It's used as an antioxidant, which helps to treat and prevent viral infections. It can help reduce symptoms more than treat the actual infection, and it is not effective at all against bacteria. So a lot of strep throat, other like bacterial pneumonia. Oil of oregano doesn't work against any kind of bacteria. It's only been shown to be somewhat effective with viruses, and so you're not going to get any benefit from it when you're using it for a bacterial infection. And we will cover later in the talk how to tell the difference on the kind of high level. There's not much data available with it for COVID-19. It wasn't really looked at as one of the health supplements that could be used in adjunct with other treatments to help prevent or treat infections. So we don't really know a lot about its use in COVID. Now, vitamin C is something that most people should be getting through their diet, but in this area, we don't have a lot of naturally vitamin C rich foods. We're lucky with Leamington just down the corner. Tomatoes do have a lot of it in it, so if you eat a lot of fresh tomatoes, you'll get some. But our citrus, because it has to be preserved or treated to be sent, picked underripe and then treated with a ripening agent, doesn't develop as much of the vitamin C that you would get if you were getting it straight down in Florida or California. So supplementing with high-dose vitamin C can be beneficial both as a preventative and to treat if you get ill. High-dose vitamin C, which the studies define as up to 1,000 milligrams a day, has been shown to reduce the duration of cold symptoms by a couple of days. And there were studies done during the pandemic of patients in hospital getting high-dose IV vitamin C to help treat the infection along with traditional therapy that they were receiving. Now, those studies showed that it did help. It reduced hospitalization, it reduced morbidity, serious complications and death from the infection. So treating with vitamin C is a relatively effective way to boost your immune system. It acts as an antioxidant, but also acts to stimulate your body's cells, again, similar to the elderberry, to help them act more effectively. Vitamin C doesn't have the same risks as the elderberry does in terms of that overstimulation of your immune system, mostly because it's a water-soluble vitamin. And if you're taking too much, your kidneys are real good. They're just going to filter it out and you're going to pee it out as you go. When we look at vitamin C, a lot of people say, well, should I take vitamin C every day? And the information on that is actually, yes, vitamin C daily can help to improve your immunity and reduce the risk of infection and illness from infection. We recommend 1 to 200 milligrams a day for prevention. And then as soon as you start finding yourself getting sick, having the sniffles, feeling unwell, jumping up to that 500 to 1,000 milligrams a day to help your body react more quickly to whatever illness you're getting. And as I said, vitamin C is relatively safe in these kinds of doses. We don't see side effects where your body's not able to process it until we're hitting significantly higher doses than we're talking you'd be able to get from even taking a whole bottle of pills from the pharmacy. I don't recommend that, by the way. Stay with the approved dosing, but the risk is very minimal with vitamin C. Echinacea is another herbal supplement that's been used for a long time for a lot of things. It's commonly used to help with the cold, can help with cold sores, which is a viral infection that is related to shingles, related to chickenpox. So it's been shown to help with that and the common cold, but it has minimal evidence showing that it's beneficial for the flu or for COVID-19. Now, that being said, minimal evidence doesn't mean it doesn't work. It means the studies haven't been done. We don't know whether it's effective or not. Echinacea is relatively harmless in the doses that you can get over the counter and off the shelf. As long as you're following the manufactured labeled instructions, you shouldn't run into much issues with echinacea. If you go too far up in your dose, or you're on certain medications, because echinacea does have some interactions, it can cause issues, but in regular dosages, it's not significantly risky. With this, echinacea is one of these kind of weird ones where we recommend a drug holiday in order to make it more effective and reduce the risk of side effects. We recommend 8 weeks on, take a week off of taking it, and then you can go back onto it. And there are some people who will do this throughout the cold and flu season, so basically starting beginning of October all the way through till March or April, and just every 8 weeks they take a week off of taking it and go back. With echinacea, as I said with elderberry, there's different parts of the plants that we use for these natural health supplements. Echinacea, there's roots, leaves, and the actual stems or branches of it, and there's multiple different species of echinacea. All of them have evidence supporting their use and showing that they are effective, but there are versions that are more effective than others. The Echinoforce is a branded name product. I'm not sponsored by them, but they use what has been shown in the studies to be the most effective combination of the Echinacea species as well as the roots, plants, and stems. Now, zinc is something that was very controversial over the last 4 or 5 years. It can help reduce the symptoms of the common cold and has been shown that it might be beneficial in COVID. really, zinc is what we call a micronutrient. It's something that basically every adult in a first world country such as Canada should be getting sufficiently through their diet if they're eating a normal, regular diet. That being said, zinc lozenges, what they do is they actually prevent, they stick to the sides of the bacteria and help prevent them from growing, as well as preventing viruses from entering the cells. And like we said with the flu, if it can't enter our cells, it can't reproduce, it can't cause us damage. With zinc, though, a couple of things. The lozenges are really the only effective form of zinc for treating respiratory, upper respiratory issues like strep throat or the cold. Zinc tablets have their place in supplementation for bone growth and for other things, but in terms of our immune system, zinc doesn't play a major role directly in the immune system, so we recommend only using it in lozenges when you're sick, because when you suck on them, the zinc tends to congregate right here in your throat where all of the bacteria are, and that's why it's effective as a lozenge, not so much taking it as a tablet to boost your immune system. But a couple of things with zinc. You want to start it at the first sign of cold or sore throat is when it's most effective, is before the virus has entered the cells, before the bacteria has grown beyond where we can prevent it from growing and causing issues. The other thing is zinc can cause some taste disturbances. It can leave you for several days after you've even taken it feeling like you've got a tinny taste in your mouth, like you just licked a penny. And it can also cause some pretty rough heartburn and side effects if you overtake it. Making sure you're following the manufacturer's recommendation based on the total milligrams of zinc in each lozenge, which is why I can't just say take 2 a day, because each manufacturer has a different amount of zinc in the lozenges, and that changes how often you should take it. But making sure you're sticking to that schedule will help to reduce the risk of side effects and make sure that it's still effective for you in terms of preventing bacterial growth. So now we're going to get into vaccines, which we've got 2 that we're going to talk about today. The flu shot is the first one. This one is out every year. In the US, it's usually out mid-August, which is, in my professional opinion, a little early. In Ontario, we're usually out mid to end of October, which in my professional opinion is a little too late. But the earlier in the flu season, when it's available that you can get it in Ontario, the better. If you get it in August, like they do over in the States, you're going to end up with some wearing off of the immune effects from the vaccine towards February, and then you're not really going to have a lot of protection March and April when there is still flu around. And then same thing, if you get it too late in the season, if you wait till December, well, you're going to be covered December, January, February, March, but you're not going to have any protection October, November when it is also circulating. So we recommend getting it as soon as it becomes available in Ontario because of when it becomes available. The flu shot is not a magic bullet. It is not even necessarily 30% effective sometimes. What happens is we've got a bunch of scientists who get together and they predict based on what they've seen last flu season, what they've seen in the South's flu season, because flu season is opposite on each side of the hemispheres. Up here in the Northern Hemisphere, Europe, Canada, US, flu season is in October through April. Down south in Australia, South America, flu season is the opposite. It's from April to August because of the way the seasons run. So they'll look at predictive data from Australia's flu season, from our last flu season, and they'll try and come up with the strains that they think are going to be circulating this year. And they will make a vaccine to match those strains that they think are out. I'm not going to get too in-depth on the flu shot, but it is usually has 4 strains in it, 2 influenza A and 2 influenza B. They cover a wide range, and the good thing about having two A's and two B's in is even if they don't get the strain of the flu that's out this year right, they're still close enough that your body is going to be able to react to it. It's going to have learned from the vaccine, even if it doesn't recognize immediately. It's going to be a lot quicker of an immune response, which is going to help to reduce the severity of your symptoms and the duration of your illness. Flu shots are one of the most widely available public health measures we have for infectious disease. They're available in pharmacies, physicians' offices, health units, walk-in clinics. The health units do mobile clinics. They are available basically everywhere you can go for healthcare services in Ontario. If you're admitted to the hospital, they'll ask you if you want a flu shot during flu season if you haven't had one. You can get a flu shot very easily once they're available. I encourage everyone to get them, as it really is one of the best things we can do, not only to protect ourselves, but to protect everyone else around us. The COVID vaccine is updated every 6 to 8 months based on the currently circulating variant. Now, because of the way Health Canada and the FDA work their drug approvals, every time it is considered a new vaccine product, and there is a lag time. So while they're developing the vaccine for the current variant, that variant might not be the one that is circulating when you get it. But as with the flu shot, it still gives your body that basic core of the COVID vaccine in order to be able to respond more quickly, to reduce your chance of severe symptoms, and to reduce your risk of infection. It's available in pharmacies province-wide. A lot of physicians' offices did it in the beginning and have dialed back on doing it because it is a very labor and documentation intensive process that the ministry has put in place for the COVID vaccines. And so they have much higher acuity things that they can and should be doing to take care of patients. And we are more available as pharmacists. Your doctor's office, you need an appointment, they're there 9 to 4. We're open 9 to 6, we're open on weekends. We've got other availability that not every physician office has. And so they've kind of stepped away in order to ensure that there is adequate supply in the places where people are more likely to be able to get them. So rather than having 5 doses at my pharmacy, 5 doses at Malot's pharmacy, 5 doses at the doctor's office, 5 doses at the clinic, they'll take those 25 doses and give them this pharmacy and this pharmacy. And then with the physicians out of that picture, it increases the uptake as well as reduces the waste, because once a vial is punctured, it's only good for 12 hours, which means if I don't use those doses in 12 hours, I got to throw them away. And so if we got 6 people and I've got 1 person at every site, we're going to waste 30 vaccines just from having it in multiple sites. So that's why they've concentrated it more on the pharmacies. The recommendation currently is to get it every 6 to 12 months. Unless you have significant immune issues, in which case it can be done at 3 months. But it's still recommended that 6 months is the minimal interval. Now, one other thing with the COVID vaccine is we also recommend spacing it away from a COVID infection. So if you've had a confirmed COVID infection or been treated for presumed COVID infection, we recommend you wait that same 6 months before you get the vaccine, because your body has significant enough immunity from that exposure to the virus as you would get from the vaccine. Next, we're going to shift gears a little bit, and instead of talking about what you can do to stay safe and stay healthy, we're going to talk about some common illnesses that are out around this time of the year. Now, of course, these are around all year, but we all know back to school is when respiratory viruses and other communicable diseases start ticking up. Kids bring it home to their parents. Parents take it to the grandparents. It spreads around the community at daycare. And so we're going to talk about a couple of those illnesses and what you can do to help protect yourself. So these are common diseases that start spreading at school. I know it says start at school and they spread at school, but once the kids got it, we all know that a 5-year-old hugs everyone they can and they put their hands in their mouth all the time, and they're not so great at blowing their nose and washing their hands. So these are some of the more common ones that we see around this time of year. Strep throat, pink eye or conjunctivitis, the common cold, influenza, COVID-19, lice, and then we are seeing a big uptick in whooping cough and other vaccine-preventable illnesses in the general population, and we'll discuss why a little bit later. So we'll start out with strep throat. Strep throat symptoms are pretty, well, what you think they are. Sore throat, a very, very, very sore throat, difficulty, painful swallowing is going to be one of your biggest hallmark signs. It usually starts very quickly. You'll develop a fever most often with strep throat. But what it doesn't have is it does not have a cough. You might clear it because it's sore, but it's not going to develop a cough that you're going to get from the infection. It's also not going to cause a runny nose or nasal congestion, and it's not going to cause pink eye either, which pink eye is an illness on its own, but it is also a symptom of other respiratory virus illnesses and is commonly found with it. Strep throat, the best and indeed only way to treat strep throat is antibiotics. Now you can prevent it by getting your tonsils out. That significantly reduces your chances of getting strep throat since you don't have tonsils for the bacteria to grow on. But if you've got strep throat, the best way to treat it is antibiotics. And it is important to differentiate between strep throat and other respiratory infections like COVID-19, the cold, and the flu, because strep throat is a bacterial infection, whereas the other ones are viral. And antibiotics don't treat viral infections, and antivirals don't treat bacterial infections. So we want to make sure that we are getting a proper diagnosis so that your bacterial infection is being treated appropriately. The easiest way to tell is a rapid strep test, which is able to be done at most clinics and doctor's offices. Unfortunately, it's not something in our scope as pharmacists to be able to do yet, but that is we are advocating for an enhancement in our scope in that regard as well. But really, the biggest thing is getting seen and getting a prescription for antibiotics. And this is because if left untreated, strep throat can lead to the development of scarlet fever, which is a potentially life-threatening illness. And it is something that we want to make sure, especially in very young and very old, that we are taking seriously and treating appropriately. That also leads me to my last point on strep throat, which is you want to make sure that you complete the full course of antibiotics that you're given. The antibiotics we give for strep, some of them kill based on how much of a dose you take, and others take time to do it. So if you're given a 10-day course of amoxicillin, take it for the full 10 days because otherwise you're not going to get a full cure. Other antibiotics are lower time frame but higher dosage. And so it's important with every infection, but especially strep throat, that you do take the full duration of your antibiotic treatment. Pink eye or conjunctivitis, this is one we see a lot of this time of year because, as I said, it shows up as a symptom of a lot of other respiratory infections, but it's also passed along through the kids, flies around, someone touches their eye, touches your hand, and you touch your eye. It's going to be spread very easily, and it is very communicable. It can be caused by a couple of different things. Pink eye is a general description. It can be caused by a viral infection, a bacterial infection, an allergic reaction, or even an exposure or an irritant, like getting a piece of metal shavings in your eye when you're working in the shop, or a piece of dust when you're out hiking in Point Pelee. Usually pink eye is self-limiting. We don't need to treat pink eye. Our bodies will take care of it in the long run, but a lot of people want to treat it because they want the kids to be able to go to daycare and the daycare won't let them go, or they want to be able to go to school and they can't, or they just don't like the way their eye looks when it's that red. For viral, allergic, and irritant pink eye, we treat symptoms. There's nothing we can do to treat the viral infection. We can treat the symptoms. For bacterial pink eye, we can actually treat the infection with topical antibiotics. And as I said already, but I'll re-stress again, infectious pink eye is very easily transmitted to others. With pink eye, we can treat it with drops, is really the only thing. We don't usually give oral antibiotics for it. And it's important to differentiate between the type of pink eye you have, because that will direct what we do. For bacterial pink eye, we'll treat it with antibiotic drops. They're available over the counter, they're available by prescription from your physician, and pharmacists are also able to write you a prescription now. We can assess and prescribe for conjunctivitis or pink eye, and we can treat all different types of pink eye depending on what we determine the causative agent to be. For allergic pink eye, we'll give you antihistamine eye drops. Again, these are available over the counter as well as by prescription. For viral, really the only thing we can give you is a wetting drop. Help soothe the infection, help soothe the irritation while your body takes care of the infection itself. We can also use those same wetting drops to help with the dryness from allergy or from irritant-induced pink eye. The common cold, this is something that's been around for a long time, certainly my whole lifetime. It's caused by any number of viruses. We don't really have a nail down of what virus can cause it because so many of them do. But it's important to understand that it is a virus, which means it can't be treated with antibiotics. So if you go in with the cold to walk-in clinic, to your family doctor, they're not going to give you antibiotics. And I don't want you to be upset by that because they're not going to do anything. What we want to do with the common cold is treat your symptoms. We can treat it with prescription products as well as over-the-counter products, nasal rinses, nasal sprays, acetaminophen or ibuprofen for pain relief. We can treat the cough with over-the-counter cough suppressants. But what's really important, and I really want to stress with whenever you're treating anything over the counter, check your ingredients on the medication, because a lot of them are the same ingredients, just repackaged. So Buckley's, Tylenol, cold and sinus, and Benylin all use the same medical ingredients, they just formulate them differently. But that also means that a lot of them have acetaminophen in them, in all of them. So you can't take both of them because you're going to get too much of some ingredients that are in them. And one common culprit we see with this is neocitrin. Everyone thinks, oh, it's just a great lemon-flavored drink that I can get, heat up and drink, and it'll help soothe my throat. But neocitrin actually has medical ingredients in it. It has dextromethorphan for your cough. It has acetaminophen for pain. And so if you're taking that with other cough and cold products or even other pain relieving products, you may end up getting too much Tylenol or acetaminophen in your system. And that can cause health complications as well. So always, always check your ingredients. The common cold is not nearly as severe as the flu. It can still cause health complications, but in people who are severely immunocompromised, most healthy adults, the common cold is going to run through, you're going to feel run down for a few days. Influenza is kind of a step up from the common cold. It's a little bit more severe, and we know what virus causes this. It's the influenza virus. Again, because it's a viral infection, it can't be treated with antibiotics, but it can be treated with an antiviral. We only treat patients who are in communal living settings, so people who live in Chartwell, for instance, other retirement homes, or people who are at severe risk of complications, so people with immune issues, people with severe asthma or COPD, things that affect the breathing and the respiratory system. Those are the people who we will treat with Tamiflu. Not really your average person. Will treat your symptoms and that's about it if you're relatively healthy. It can cause death, and I know that sounds a little severe, but it can, in everyone, but especially the very young and the very old. So if you're feeling unwell, don't go around, well, shouldn't go around anyone really, but you shouldn't really avoid going around people who are more vulnerable. And those are the people we've already talked about, as well as people with cancer or HIV. It increases their risk of severe complications. And as with pink eye, this is now something that pharmacists are able to assess and prescribe for. We cannot do the rapid testing to determine for sure whether it's influenza or not. But we are able to assess based on symptoms, based on course of illness, based on how you present, and determine whether you likely have influenza or not, and whether you're qualified for treatment or not. So if you're ill, and for any of these infectious illnesses, if you can do a virtual appointment, it's better so that you're not exposing people unnecessarily. But for some things, that's not always feasible. For instance, strep throat, we may want to do a rapid swab at the clinic, so better to go in. But if you are going to be coming out while you're ill, using those precautions of keeping distance, wearing a mask, frequent hand washing, frequent sanitizing. COVID-19, and I know this horse has been beat to death over the last 4 years. I think that's all we've talked about in the infectious disease community for quite a while. Again, it's a viral infection and can't be treated with antibiotics. But something a lot of people miss, and they think the COVID virus is new. Coronaviruses have been around for a long time. SARS, when it initially was in 2008, as well as MERS, the Middle Eastern Respiratory Syndrome, were both different strains of coronaviruses that caused those infections. They just didn't have the long incubation period, which meant people were sick sooner, which meant they were caught sooner and able to be treated and isolated sooner. With COVID, as we know, it's got that nice long 14-day window where you're likely to be able to transmit it to other people without even knowing you have it. Coronaviruses have been around for quite some time. In fact, some of the viruses that cause the common cold are of the coronavirus family, which just describes the shape of the virus. COVID can cause death and serious illness in anyone, but again, we see it mostly in the very young, the very old, and people who have higher risk medical conditions. Your COVID shot will help prevent you from contracting it. It's not going to eliminate the risk, but it's going to reduce it, and it's going to reduce your severity and duration of symptoms. COVID can be treated with an antiviral, but it's important to note that the antiviral we use, Paxlovid, which is what we use in the outpatient setting. There are IVs you can get in the hospital if you're severe, but we want to prevent you from getting to that point. But the antiviral that we give you in the community, it helps to reduce the severity of the symptoms, but it can actually lengthen the duration of your illness because all it does is keep the viral load lower so that you're not getting as much of a burden from the virus at the same time, but it still is going to run its course. So that's why we target the treatment with it to people who are on that really moderate bordering on severe, because then we can bring them down to mild to moderate symptoms. And even though they'll be a bit longer getting better, they're not going to get as sick. Whereas someone with mild symptoms, if you just have runny nose and a little bit of a cough, it's not going to be as beneficial for you, and it's not going to do what you're hoping it's going to do, or what most people are hoping it's going to do. As with flu, this is something that pharmacists are now able to assess and prescribe for. The ministries used to pay for Paxlovid completely free for everyone. Starting in May, they are only paying for people who are eligible for Ontario Drug Benefit funding. So seniors, people on social assistance or disability are eligible for coverage from the ministry for the actual viral product. Some private insurances pay for it, some don't. And here's something else to maybe put a thought in your mind if it's not covered for you is, it is quite expensive if it's not covered since the ministry is no longer funding it. So, how do we tell the difference? How do we tell the difference between COVID and flu and strep throat and the common cold? We look at the symptoms, and I'm not going to run through this whole chart because I'm just going to be standing here reading, Well, it's here, but I'm going to point out some of the more common differences that we'll see. So fever is one of the biggest differentiators. It's common in COVID as well as influenza. The cold, you rarely will have a fever. And in strep throat, you can have it, but usually it's a low-grade fever. If your fever is going, 102, 104, that's when we're more likely to suspect a COVID or a flu infection than we are anything else. Because that's our body's first line of defense. Raising our body temperature, bacteria don't survive at heat. It's the reason we cook food, is to kill the bacteria. Our body is basically trying to do that with a fever when it raises our temperature. Your aches and pains are another one. With the common cold, you're not really going to feel that kind of achy, chilly feeling. But with COVID and flu, you will. And with COVID, it's usually pretty severe. Strep throat, you're not really going to have any. It's just going to be that sore throat is going to be your biggest symptom. Fatigue is another big one, as well as your sneezing. Sneezing is very rare in COVID, strep throat, and not that often in influenza either. But in the common cold, repeated sneezing fits is very common. And so that is one of those differentiating symptoms that we'll look at. Fatigue, very rare for most of the conditions. For the flu, it's going to start early. You're going to feel run down. COVID may take a few days, but you are going to feel that run down. And one of the bigger differentiators between flu and COVID is you may feel a little run down longer with a COVID infection than with a flu. I'll just cover on this one with loss of taste. It's very unusual in strep throat, the flu, or the common cold. Very common in COVID. So that loss of smell, that loss of taste is a big differentiating sign that it's a COVID infection and not something else. With the exception of if you're congested, got a lot of nasal congestion, a really runny nose, because we know sense of smell and sense of taste, very linked. You can't smell anything when your sinuses are packed, so it will reduce that sensation, but it's not going to eliminate it like you really see with a COVID infection. And then pink eye is rare in the flu and really unusual in a strep throat infection. But with the cold and COVID-19, we do see quite a lot of viral conjunctivitis or viral pink eye with it. Cold, flu, COVID, and even strep throat, symptom treatment is one of the biggest things we do, especially if you don't qualify for treatment with an antiviral. We want to make sure you're treating your fever and your pain with either acetaminophen or anti-inflammatories like ibuprofen, naproxen, even aspirin. Aspirin is an anti-inflammatory. You can use it at treatment doses, but it has a bit of a higher blood thinning effect, so we usually try and avoid that, and we definitely want to avoid it in anyone under the age of 18 years because it can lead to some hearing side effects for them that can be permanent. We want to make sure you're staying hydrated, you're well rested. There's something to say about chicken noodle soup in bed. It helps. You can also use sinus rinses to help clear out that nasal congestion. And gargling with salt water. I know it sounds very simple, just taking a couple of pinches of salt, mixing it in with some warm water, and gargling with it can really help to soothe a sore throat. Now, other vaccine preventable illnesses, whooping cough, tetanus, pertussis. We used to see these very rarely, but we are seeing resurgence of them, mostly because of vaccine hesitation in the younger population. And this is something that's gotten worse over the pandemic for a number of reasons. One was lack of access. You couldn't get into your doctor to get your regular vaccines. You couldn't take the kids in. So part of it was lack of access. Part of it is now there is a lot more vaccine hesitancy because of some of the side effects and issues that we did see with the COVID vaccines. But what we need to remember is that these other vaccine preventable illnesses, while not as common as COVID, are still very high risk to your health. And we still want to make sure that we are getting vaccinated for them because they are very safe vaccines that have been used for decades in most cases. And making sure that you are up to date on all your annual vaccines, your yearly, your some that you need every 6 years, some that you need every 10, some that you need once in a lifetime. Making sure that you're reviewing your vaccination records with either your pharmacist, your physician, nurse practitioner, to make sure that you are up to date on all of those vaccines will help to prevent it being transmitted throughout the community, which is really what we want to do. Is if we can prevent it from getting a foothold, it's not going to be able to spread. Lastly, we're going to talk about lice, which is a pretty common infection that we see coming home from schools. And I know some of you out there in the audience don't really need to worry about it. I'm looking at you. No hair makes it easy. But it's very common to come home from school-aged children and very easy to jump from kid to kid, from house to house, from parent to kid, or kid to parent. Wearing a hat with someone who you didn't know had lice. The lice will be on the hat, they'll jump to your hair. Sharing a pillow. Hairbrushes. Kids just playing can transmit it to one to the other. It's important, and I know a lot of parents really struggle with, oh my God, my kid has lice. Now, it's not a sign of a dirty kid. That's not what lice is. In fact, lice actually prefer cleaner hair. Where would you prefer to live? A pigsty or a mansion? Same thing. It's very easily transferred around. And lice, I'm not going to touch on much because most of us here don't have to worry about it, but the grandkids or great-grandkids can still bring it home. There are a lot of products all available over the counter that treat lice. But what's important is that you follow the directions on the packaging meticulously. Some products need to be on wet hair. Some of them need to be applied to dry hair. The wet ones, the ones that you apply to wet hair, the product seals around the lice and prevents them from being able to continue growing. The ones that you apply to the dry hair, when the lice get wet, they seal up, and they do that for while the hair's wet, so the medication can't get in, and the medication gets in and kills them if you apply it on dry hair. So it's important that you follow the manufacturer's directions on it, because depending on what product you get, it may or may not be effective if you apply it to wet hair or dry hair. After you treat the infection with the product, you're going to want to go through with a fine comb, go through, pull out all the dead lice, pull out as many of the nits as you can. You're usually looking about 5 millimeters up from the root is where you're going to find them. And then you want to retreat in a week. And that's because any of those eggs that you missed while you're going through with the comb will have hatched and can be killed by the product. But they are not at an age where they can themselves lay eggs. So you treat twice, a week apart, usually takes care of it. Now, most importantly, what can you do if you're sick? Talk to your doctor, talk to your pharmacist, talk to your nurse practitioner, get assessed for what you think is wrong, get treated, and stay home from work or school. Make sure that you're staying hydrated, staying rested, and keeping healthy. That's the end of our presentation for this evening. I'll take some questions afterwards, but I'd like to invite you all to join us next time on November the 14th, back here at Unico Hall at 6:30, where we'll be discussing pain management. Thank